We meet this morning at an inflection point. We are shifting our focus from the urgency of the COVID public health crisis to confronting the virus as an enduring epidemic, while also simultaneously attacking the other challenges that threaten the health and well-being of the American people. When you last visited this committee, Mr. Secretary, the COVID vaccine was rolling out publicly. Now 219 million Americans have been fully vaccinated. Let me make a point here. In March of 2020, on March 11th, that's the day that Dr. Fauci gave his warning of what was to come. And we have endured this pandemic, but when you look at 219 million Americans fully vaccinated, it tells a very optimistic story as well. 2.8 million Americans signed up for health coverage under this administration's special enrollment period, and over 90% of these new enrollees benefited from the committee's premium tax credits. These impressive strides are thanks to Joe Biden's visionary leadership, as well as the hard work of your team, Mr. Secretary, healthcare workers and public officials as well. But most importantly, it's the result of the trust the American people have placed in our institutions. We still have much more work to do. We should do it together. For example, the permanent increase in child care funding that the Ways and Means Committee fought to include in the American Rescue Package is just a first step toward guaranteed access to child care that parents need. Our vital caregiving workforce is still paid too little and stretched far too thin. Looking ahead, this committee is confronting the multidimensional nature of health, well-being, and equity. From health disparities to the long-standing problems in our delivery and access to mental health services, it's clear that life's circumstances have a cumulative effect on one's health. Any successful strategies must acknowledge the stigmas and structural inequities that for far too long have plagued our healthcare system. Mr. Secretary, I know that that is something that is near and dear to your heart, and it's called the Affordable Care Act. In the 12 years since President Obama signed the landmark law, 30 million more Americans have gained health coverage, and 135 million Americans with pre-existing conditions have benefited from the law's transformational protections. Even while there has been opposition from the other side, in many cases, some fought tooth and nail to strip Americans of the health care coverage, we continued throughout the pandemic's public health care crisis to embrace it. We stayed the course and we strengthened the ACA. Without a doubt, Democrats take great satisfaction from the improved health care system in this country because of it. Every child in Massachusetts has health insurance, and 97% of the adults in Massachusetts are all covered. It's an astounding statistic, and it continues to poll in the high 70s in the state in terms of satisfaction. We took dozens of votes and dozens of times over the years, too much time to repeal the ACA. The other side oftentimes declined to put forward their own health care proposal, but perhaps that plan someday will emerge as we attempt to address inflation as well. We've chosen a path of action and results, lowering costs, expanding coverage, and saving lives. As a result, enrollment is at an all-time high, premiums are down, and the law's popularity is considerably up. Now we must build upon this progress by permanently investing in the improved premium tax credit. We note that premiums dropped on average by $67 a month and saved families over $800 annually in the past year thanks to the American Rescue Plan's expanded credit. These are the types of investments that grow the insured population and spread risk, which in turn will help those covered by the ACA remain covered. I'm grateful for President Biden's comprehensive strategy to address our nation's mental health crisis as well. The budget's historic investment in improving mental health also acknowledges the connection between mental health and substance abuse. The committee, until recently, we have attempted to hold a series of hearings on these topics where we heard loud and clear that the current mental health crisis calls for expanded coverage and reduced cost for mental health services. We also know that we have to invest in a diverse mental health workforce. Improving care for nursing home residents and our nation's seniors is another important priority of the Ways and Means Committee. The last 2 years have unfortunately shown a bright light on where these facilities are coming up short. The committee has led on the Elder Justice Act to protect residents and improve the quality of care, but more must be done, and we look forward to working with you, Mr. Secretary, on this pressing matter. We're eager to work with you and the Biden administration on building a healthier, more equitable America. Our committee's Racial Equity Initiative is examining the drivers of healthcare disparities. We have examined the need for a more diverse physician pipeline and how clinical algorithms may well discriminate. We are urgently working to advance legislation that creates a more equitable society, and I know that the Biden administration will be a full partner as we proceed with this work. I'm pleased, Mr. Secretary, to note that your department has begun to address the climate issue as well. The impact of the climate crisis on healthcare is well documented. Yet less attention has been paid to the role of the healthcare industry in producing greenhouse gas. For this reason, the committee has made a request for information from healthcare organizations regarding their work to combat the climate crisis. Their responses will be vital in helping us develop policies that will support and promote climate action changes in the healthcare sector. Looking ahead to the post-pandemic life, it is time to deepen our investments in the American family. Ways and Means Democrats continue to push and put forth policies to invest in child care and create career pathways for low-income parents. We also expect to work closely with you and our Republican colleagues to reauthorize the Maternal, Infant, and Early Childhood Home Visiting Program and the critical child welfare programs that accompany it to strengthen them for the future. We've covered a lot, but as we all know, there's a myriad of challenges that face the health and well-being of the American family. I think I can speak for all of us when I say how pleased we are to welcome an esteemed former Ways and Means member back to our committee. Look forward to this partnership as we work together to improve the health and well-being of the American people.